When disaster and tragedy struck the people of Haiti, Doctors Council SEIU responded within a matter of hours. We reached out to our members for volunteers to go to Haiti to provide vitally needed medical care, and Doctors Council SEIU members were in Haiti within days of the disaster. What follows is some of our members' experiences, including what they did and what they learned. What we all learned is that not only is Doctors Council SEIU a national union for doctors, but when needed, an international union for patient care.
So the first that I actually heard about that was through the Doctors Council. I believe it was either the first or second day after the earthquake.
Well, I'm a member of Doctors Council, and when the thing first happened, I received an email where they were asking for people to volunteer to go to Haiti for the earthquake. Well, it was a great opportunity for me, because I wanted to go there and I couldn't do it. So it was when Doctors Council sent the email, I appreciate the fact that they did that, and then it was, I was excited to be part of this.
I went down to Haiti after volunteering and being very surprised that I was called so quickly. It was an amazing experience. I was really gratified that Doctors Council had been able to organize this so quickly.
I was really glad to hear that the union was doing that, and so Doctors Council was offering that opportunity and was doing that legwork for us. So I was really glad to hear that the Doctors Council was helping physicians find an organization to go down with.
So it was if it wasn't for Doctors Council, I would not have the opportunity to go to Haiti and be part of this help.
Well, I wanted to go to Haiti and multiple reasons. First, I am from Haiti originally, and then I learned the extent of the disaster because I watched the news and the images were slow coming, and then I saw the suffering and things that I could do to help, and I wanted to be there. I was born in Port-au-Prince, and believe it or not, in the hospital where we really were based, and that was the hospital where I was born in, and then I was basically at home.
Because I'm Haitian. I was born in Port-au-Prince, Haiti, and it was the hospital where I was born, University Hospital of Haiti. That's where I was born, and I ended up, when I went there, thanks to Doctors Council, I had the opportunity to work there in the emergency room and help out.
The feeling, to put it in perspective, I compare it when I heard about the news, and I had the same feeling I had with 9/11, that you could relate probably better with that. And on 9/11 I put on scrubs when I first learned of the disaster and ready to go help, and I found nothing to do. And then when I learned about the news in Haiti and about Haiti, I felt the same when I wanted to jump and get there, but I couldn't go. And immediately until I make arrangement and found Doctors Council with the program and to go.
So coming in over Port-au-Prince was just kind of a surreal experience. First, to see the density of all the buildings in Port-au-Prince. I mean, it's not much different than it's like flying into New York City. That's, the population is so dense and the number of buildings is so dense. And so I think, like, when I first started seeing so many buildings in such a small area, and then just started thinking about what we had seen on the news with all of the destruction of all the buildings, I mean, I just started getting definitely very nervous.
Like, I knew it was going to be a desperate situation. It was really similar in some ways to what I saw in Katrina in New Orleans, which was also very desperate. And so when I got there, I was struck by the visual stop motion pictures of an earthquake still in motion. I mean, it was over, and yet it looked like it was still going on because buildings were hanging over, and it was really a shocking scene.
It was a crazy thing. It was really a disaster. Everything was in chaos. There was nothing going on that makes sense. Everybody was in the street, and we see people under the tents and we see people who just walking around in the street and everything was just destroyed.
We went down with a very large group. There were 23 of us. Actually, this is the French group, but I wouldn't dare try to pronounce it. There were 23 of us, 8 doctors, 1 general surgeon, 1 orthopedic surgeon, a gastroenterologist who is Paul Nassier, who is the president of the AMHE. He was down there with us. He led the group. We had 1 OB-GYN doctor. We had 1 internal medicine doctor, an anesthesiologist, 1 ID doctor with me, and 1 resident. We had 12 nurses. It was a matter of trying to bring down supplies. And so being an infectious disease doctor, when we talk about medical supplies, the first thing I think about are antibiotics. And this is an example of the one of the tents. I'm not sure if this is the intensive care unit. This is some of the structure. This is the intensive care unit with one of our nurses who was down there. We saw a lot of cerebral malaria when we were there. We actually had some typhoid fever with a rupture of the small intestine that we also took care of. We had a lot of HIV over there. We had dehydration. We had sepsis. We had a lot of postpartum cardiomyopathy, which I thought was kind of interesting.
One thing I'll say is that, you know, the history of Haiti, you know, if you read the history of Haiti, it's heartbreaking. Before the earthquake, all the health indicators there were already, there were a lot of dire health needs before the earthquake. And then when you had the earthquake, you know, it's created a huge need that's going to go on for a long time. We were seeing, our top numbers were about 500 people in 24 hours.
I'm Dr. Pamela Smith. I work in Fantis Building. Internal medicine is my area of specialty. So basically, while I was there, I was an internal medicine doctor, I was an ER doctor, I was a psychiatrist. There were a lot of psychological things going on with people. This patient came in presenting very similar to an acute abdomen. There was a lot of, like you say, postpartum cardiomyopathy, people with ascites from CHF. There was a lot of ascites from liver and renal disease.
The other thing, I was actually doing internal medicine like inpatient, which is actually the whole hospital besides the ER. And the main thing there is like, when I get there, we were only 2 persons doing internal medicine, doing the wards, and there are 300 patients. So as you can see, one day you could see 50 patients. The next day you decided to continue what you were doing with those 50 patients you saw and try to improve them, or you just go and see the other remaining 50 patients and change. And then there was no continuity, so we need more people there.
As soon as we got to the site, we would start seeing patients pretty much immediately. Generally, when we would arrive at the clinic site, there'd be a line of, it could be anywhere from, generally a line, at least 100 people already waiting to see us when we would get there. And then just start seeing patients. And usually at the site in Carrefour, we would see, each physician would see around 40, somewhere between 40 and 50 patients for the day. By the second week that I was there, we started seeing very common primary care chronic diseases, diabetes, hypertension, and then we certainly started seeing more and more depression and anxiety during that last week that I was there.
The clinic was usually 85, 90 degrees. There was no real ventilation there. It was pretty hot. The clinic was in the middle of a tent city, and so there were a lot of tents, but not everyone had tents. So a lot of people, even though they were living in tents, they could be lying down on the ground. I was struck by how good-hearted and flexible people were in dealing with some pretty tough situations. The emergency room had no ventilators. It had very little medication. Gunshot wounds would come in and people would be given morphine and let die because they couldn't really do much. And that's very hard on an emergency staff. And they have to learn how to adapt to that and just carry on and do the best they can.
You know, overall I would say it was completely heartbreaking, completely devastating, but at the same time I think I was able to learn so much about, you know, basic medical principles, going back to the basic sciences of medicine, really going back to the basics of humanity and why we do practice medicine in the first place. It just taught me that, medicine is really not all about technology and medications. It's really about caring for an individual. When you're practicing in a situation like this, the only two things that matter are you and that patient and the relationship that you're forming.
But like, as the time goes by, then you start learning, or not learning, going back to what you learn in med school with your clinical skills, and you also learn from the other doctors. So it's a great experience.
It's a life-changing experience, and I think when you're down there, you feel like you're really part of this team.
I would do it again, and I would recommend somebody else to do it. Why? Because there was a need for it. We were really useful there. It's not that we just went to have fun. It was really useful. The people needed the help, and they got it. So I would definitely recommend some doctors to do that. At one point, one of the lady that was there coordinating things, she came and asked who was from Doctors Council, and a group of us came together from different places, different states. That's the time that we all saw, okay. We were excited to see if we came from the same organization.
At the beginning, I felt like everybody was hopeless, but when I left, I think they had hope. They were like so great, like they had so much gratitude towards the people who were there, and they were like, thank you for being here and for coming, just stay here. And I think we have to take them because it's a great experience, not even on the personal level, but also on the professional level.
The real satisfaction and happiness of being there and feeling like I was making some wonderful bonds with some people down there. The patients were wonderful. I really found I hit my stride down there.
It was a great experience. I didn't know, people would do something like that. That was my first time. And it was, amazing to me. Yeah, I'm still thinking about that and feel the emotion of it. Yeah, that was the main thing, the humanitarian thing, like people that taking time and do this for these people that they didn't know. Yeah, it was a blessing for me to have been there.
The patients told me the people had they've been through a lot, and most likely because of the centuries of turmoil that they've been dealing with. So to add this on again, they taught me that don't take anything I have for granted.
It was uplifting, to say the least, and then that's make us pretty proud of the union. Besides bringing a tent and sleeping bags, and bring a heart to serve for the love of humanity, and then really this is all you needed, and it just shows you the compassion and the humanity of people, and when the other people are in need, and then if only we could do that forever.
Everyone has said that they came back and their lives were changed by it in one way or the other.
I think that we were welcomed quite warmly. The interactions with all of the patients that I had were very warm. A lot of gratitude. Thank you so much for coming here.
But what I learned actually was that as physicians, we have to be prepared to deal with certain challenges that perhaps we are not trained to face, and we have to quickly do something about it.
I think it would be a good idea for the union, for Doctors Council to really put a group of doctors together that know that strength in emergency medicine, surgery, and things, that would have an idea, that would know what to expect, what they would be able to do, and to respond to medical crises in local, national, and international. It would be a definitely good idea for that. Yeah.
I think it is a great idea, and to have really doctors trained and then forming a committee and ready to go in a moment notice, and for disaster that can happen either locally or internationally, and then that will be in a heartbeat and then ready to go, and that will be an excellent idea. Frères haïtiens, sœurs haïtiennes, rete fort. Nous connaissons que nous avons pour sauter dans tout ça. Et nous-mêmes, docteurs, nous ne pouvons pas oublier.
We have a trauma bed dedicated. We're good to go.
Dr. Fred Martin from Chicago is in charge of the night shift, among a group of doctors trying to keep the system from total collapse.
I see one bed back here, 2 beds.
And just finding beds is a problem.
There's 3, that's pretty good. The main challenge has been the critical patients. There have been times when the ICU has been overwhelmed. So we're going to treat you for a parasite. 1 pill, it's easy.
It's anything but easy for the doctors, the job taking a physical and emotional toll.
So that's 24 hours. And 26 hours.
Dave McKenzie, CNN, Port-au-Prince, Haiti.
Moi apprécie Doctors Council parce que moi suis membre de Doctors Council et nous toutes, moi très fier de nous toutes qui allés en Haïti, qui fait ça dans le faire. Et je pense que c'est une bonne idée si on va passer encore que nous toutes qu'à retourner pour nous mettez-nous ensemble et puis nous tourner dans le faire même bagarre là. So m'apprécier que je fais partie de groupe là et que réellement fait son honneur pour moi. Pour me travailler avec nous, pour nous aller Haïti ensemble. Doctors Council, merci. Et tout docteur Octaleo, merci beaucoup.